Gastrostomy tube feeding. The purpose of a gastrostomy tube button is to administer food, fluids, and medication directly into the stomach. This method is used to bypass the usual route, which is the mouth, when A, there is an obstruction of the esophagus, B, swallowing is impaired, causing a risk for choking and/or aspiration, or C, the person has difficulty taking enough food by mouth to maintain adequate nutrition. Types of gastrostomy tubes. The gastrostomy tube extends externally from the stoma and must be secured inside the clothing using tape or stretch netting. A gastrostomy skin-level device uses a detachable feeding tube and has an anti-reflux valve to prevent leakage of stomach contents. This device lays flat against the abdomen, allowing a wider choice of clothing and more freedom of movement. The barred button and the McKinney are the most common skin-level devices. Both remain in place at all times and are closed between feedings to prevent leakage of stomach contents. There are two methods of feedings, bolus and continuous. A bolus feeding provides a specific amount of formula administered by gravity or pump over a period of 20 to 30 minutes. Bolus feedings are given 3 to 6 times a day. The equipment you will need includes prescribed formula feeding and medication if ordered at room temperature, a 60 cc catheter tip syringe, measuring containers for formula and water, non-latex gloves, container for equipment and supplies, disposable towel, gastrostomy tube, clamp or plug for catheter, skin-level device, a bolus extension set, decompression tube if needed, soap for washing equipment, plastic bags for waste disposal. Bolus feeding. These are the steps for bolus feed procedure. You want to explain the procedure to the pupil, providing privacy during feeding if indicated. Wash your hands. Assemble equipment on a clean flat surface. Verify that the feeding is at room temperature. Check formula expiration date. Shake hands well. Measure prescribed amounts of formula and water in clean containers. Position the pupil in a semi-sitting position or lying with head elevated at least 30 degrees unless contraindicated. Arrange pupil's clothing to expose gastrostomy tube button site for continual observation during feeding. Place a disposable towel on pupil's lap. Put on non-latex gloves. Use standard precautions. For a bolus feed procedure via gastrostomy button, you will administer the feeding. A licensed nurse may administer prescribed medications before or after the feeding according to authorization. You want to verify placement of the tube in the stomach, check residuals and decompress vent if ordered, remove cap from end of G-tube, insert catheter tipped syringe without plunger into end of G-tube, cover end of syringe with gloved hand. Unclamp the tube, slowly lower syringe barrel until stomach contents can be seen in tube or gas is released. Clamp tube, close to distal end. Pour feeding into tilted syringe and fill tube. Unclamp the tube, allow liquid to flow in slowly by gravity. Continue to pour feeding into syringe as liquid flows into stomach. Give formula slowly over 20 to 30 minute period. If needed, occasionally hold syringe below level of stomach to allow any gas buildup to escape. Be alert to any changes in pupil's tolerance of feeding. Stop feeding immediately if pupil has difficulty breathing or color changes. Also, notify your school nurse. After feeding is completed, Let formula drain to bottom of syringe and clamp tube. Vent, if ordered, prior to flushing. Flush the G-tube when venting is complete using syringe. Instill by gravity flow, prescribed amount of water. Clamp G-tube, allowing some water to remain in the tube. Remove syringe and insert cap into the end of G-tube. Secure tube and tuck inside clothing. Remove gloves and wash hands. For a bolus feed procedure via G-tube, you want to verify placement of the tube in the stomach, check for residuals and vent if ordered, remove plunger from the syringe, attach syringe to bolus extension tubing, clamp close to opposite end of tubing. Remove the feeding port cover from button, stabilize button with one hand. Attach bolus extension tube, set the feeding port. Align lock and key connector. Follow manufacturer's instructions to lock extension set in place. Remove clamp. Slowly lower syringe barrel until stomach contents can be seen in tube or gas is released. Clamp tube, close the distal end. Some skin level devices require use of special decompression tube or air releasing tool. Follow manufacturer's instructions attached to that procedure. Pour feeding into tilted syringe and fill tube. Unclamp tube, allow fluid to flow in slowly by gravity. Hold syringe 3 to 6 inches above the level of the stomach. Raise or lower syringe to adjust the flow. Continue to pour feeding into syringe as liquid flows into stomach. Give formula slowly over 20 to 30 minute period. After feeding is complete, let formula drain to bottom of syringe and clamp tube. Be alert to any changes in pupil's tolerance of feeding. Stop feeding immediately if pupil has difficulty breathing or color. After feeding is complete, let formula drain to bottom of syringe and clamp tube. Be alert to any changes in pupil's tolerance of feeding. Stop feeding immediately if pupil has difficulty breathing or color. Vent if ordered prior to flushing. When venting a button other than Mickey, insert decompression tube into button, then attach syringe. Venting prevents abdominal distension and discomfort. Flush G-tube when venting is complete using syringe. Instill by gravity flow, prescribed amount of water. Water should be at room temperature. Flushing prevents buildup of formula inside the tube, which can cause a clogged tube. Clamp tubing, remove syringe and extension set. Close feeding port with plug. Remove and discard gloves. Wash hands. Post-feed care. If pupil is non-ambulatory, maintain them in an upright position or on right side with head elevated at least 30 degrees for 30 minutes. Observe pupil closely for symptoms that indicate untoward effects of feeding. Contact school nurse, authorized healthcare provider, and or parent if complications occur. Tube feeding by pump. The equipment that you will need for a pump continuous feed includes the prescribed formula feeding and medication if ordered at room temperature, a 60 cc catheter tip syringe, measuring containers for formula and water, non-latex gloves, container for equipment and supplies, a feeding bag, a stand or hook to suspend feeding bag, disposable towel, optional, a tray to hold feeding equipment, gastrostomy tube, clamp or plug for catheter, a skin level device button, including a bolus extension set, decompression tube if required, liquid detergent for washing equipment, plastic bags for waste disposal. You want to explain the procedure to the pupil, Provide privacy during feeding if indicated. Use developmentally appropriate communication. Encourage people to participate to extent possible. Wash hands. Assemble equipment on a clean, flat surface. Verify that feeding is at room temperature. Check formula expiration date. Shake cans well. Measure prescribed amounts of formula and water in clean containers. Maintain a clean field during procedure. Refrigerate any unused portion of feeding in clean covered container labeled with pupil's name, date, and time. Prepare feeding administration set. Clamp feeding tube attached to feeding bag. Pour formula feeding into feeding bag. Suspend bag from hanging apparatus. Squeeze drip chamber until it is half full of formula. Unclamp tubing until fluid has reached the end of tubing. Reclamp tubing. The feeding bag should be suspended higher than the level of the pupil's stomach. Filling tubing with fluid prevents air from entering stomach when feeding begins. Position pupil in semi-seating position or lying with head elevated at least 30 degrees unless contraindicated. Arrange pupil's clothing to expose gastrostomy tube button site for continual observation during feeding. Place a disposable towel on pupil's lap. Elevation of pupil's head facilitates digestion and prevents vomiting and aspiration of fluid into lungs. Authorized healthcare provider may specify an alternative position. Put on non-latex gloves. Verify placement of tube in stomach. Check residuals and vent if ordered. Follow these steps for gastrostomy tube. You want to insert catheter tip syringe without plunger into the end of G-tube. Cover end of syringe with gloved hand. Unclamp the tube. Slowly lower syringe barrel until stomach contents can be seen in tube or gas is released. If stomach contents or gas are not obtained, do not proceed, notify school nurse. Clamp tube closed to distal end and disconnect syringe. Follow these steps for gastrostomy button. Remove plunger from syringe. Insert catheter tip syringe into extension tubing. Clamp closed to opposite end of tubing. Remove the feeding port cover from button. Stabilize button with one hand. Attach extension tube set to feeding port. Align lock and key connector. Follow manufacturer's instructions to lock extension set in place. Remove clamp. Lower syringe barrel until stomach contents can be seen in tube or gas is released. If stomach contents or gas are not obtained, do not proceed. Notify school nurse. Clamp tube and disconnect syringe. Some skin level devices require use of a special decompression tube or air releasing tool. Follow manufacturer's instructions attached to procedure. Continuous feed via both methods. Administer feeding. Pour feeding into feeding bag. For button, connect extension tubing to administration set. Run feeding completely through tubing, clamp tubing. Hang bag on hanging device at height required to achieve authorized flow. Authorized healthcare providers specifies flow rate. Check flow rate periodically and adjust as needed. Open G2 plug or feeding port cover. Insert feeding bag tubing into G button. Align lock and key connector. Follow manufacturer's instructions to secure extension set. Open clamps on tubing and G-tube. Manually regulate fluid drip to prescribed rate. For continuous feeding, add fluid to bag when it is almost empty. Monitor pupil's tolerance of feeding. Stop feeding immediately if pupil has difficulty breathing or color changes, notify school nurse. When feeding is completed, clamp feeding bag tubing. Disconnect from G-tube. Vent if ordered prior to flushing. When venting, a button other than Mickey, insert decompression tube into button, then attach syringe. Flush G-tube when venting is complete. Using syringe, instill prescribed amount of water via gravity flow. Clamp the G-tube, allowing some water to remain in tube. Remove syringe. Button, remove syringe and extension set. Close tube or button. Water should be at room temperature. Flushing prevents buildup of formula inside tube, which can cause clogged tubes. Water also helps maintain hydration. Secure G-tube under pupil's clothing. Remove and discard gloves. Post-feeding care. Position. If pupil is non-ambulatory, maintain their upright position or on right side with head elevated at least 30 degrees for 30 minutes. Observe pupil closely for symptoms that indicate untoward effects of feeding. Contact school nurse, authorized healthcare provider, and/or parent if complications occur. Cleaning and storing equipment. Put on gloves. Flush feeding equipment thoroughly with cool tap water immediately after use. Wash syringe, bolus extension set if used, and other reusable equipment with warm soapy water. Rinse thoroughly. Rinsing with cool water helps to remove milk products. Shake excess water off equipment. Allow to air dry. Place cap on syringe tip after drying to prevent bacteria from settling on tip. Store equipment in a designated container in a clean area. Open formula should be stored in a clean, labeled plastic container, not the original can. Equipment can be placed in zippered plastic bags and refrigerated to inhibit bacterial growth. Refrigerate. Discard unused formula after 24 to 48 hours. Dispose of waste materials. Remove gloves. Wash hands. Documenting procedure on daily log. Date, time, and duration of the feeding. Results of decompression and residual check. Amount of feeding formula and water given. Pupil's response or their tolerance. Note pertinent information such as appearance of abdomen and stoma. Problems reported to school nurse or parent. Problems that require immediate action. If the student has nausea, vomiting, abdominal pain or cramps, diarrhea, dizziness, bloating, fatigue, heart palpitations, rapid heart rate, sweating, weakness, shakiness, fainting, or mental confusion, those could be signs or symptoms of dumping syndrome. Dumping syndrome is when the formula is instilled too rapidly with possible hypoglycemia. You'll want to stop feeding immediately, and you'll want to take action specified by the healthcare provider in the student's orders. Contact the school nurse, monitor the student's vital signs, or call 911 if the pupil's condition worsens. Another problem that requires immediate attention includes tube displacement. This is when the tube is out of the body or obviously displaced. Choking, abdominal pain, nausea, vomiting could also be symptoms of a tube displacement. This is when the tube is not adequately secured. There is excessive pulling on the tube, persistent vomiting, or the balloon deflates or bursts. You'll want to stop feeding immediately, contact the parent and school nurse immediately, The tube must be replaced within 1 to 2 hours to maintain patency of the stoma. Problems that are not emergencies include nausea and or cramping, abdominal distension, feeling bloated. Also, the student may have vomiting or dry heaving and may continue vomiting and may cause loss of body fluids, salts, and nutrients. You'll want to contact the school nurse about possibly decreasing the flow. You'll want to check the tube to identify whether tube has moved. You will want to contact the school nurse for immediate assessment. You'll want to correct the pupil's positioning unless contraindicated. Always practice good hand washing and clean technique. Check formula storage practice. Call the school nurse if vomiting occurs more than one time. Contact parents if virus is suspected cause. Acutely ill pupils should not be in school. Additional problems that are not emergencies include diarrhea, blocked tubing, or skin site irritation. For diarrhea, you'll want to inform the school nurse, who will discuss the problem with parent and refer if needed. With blocked tubing, you'll want to try flushing with warm water after feeding or medication. If the blockage remains, contact the school nurse and the parent or caregiver. For skin site irritation, clean the area per authorization. Apply dry dressing. You may need to clean the skin and change dressing more frequently. If the pupil develops a fever of 100.5 or greater, you'll want to suspect infection. Contact the school nurse and parent immediately. Other non-emergent problems include excessive leakage around the tubing, bleeding, and dehydration. If you do experience excessive leakage around the tubing, you'll want to contact the school nurse and or parent. Also, the healthcare provider should be contacted. With bleeding, any bleeding around the tube may be caused by accidentally pulling on the tube, causing injury. If there's any blood in their vomit or stool or in the tube, it may indicate internal bleeding. You'll want to secure the tube more adequately if there's more than a few drops of blood and contact the school nurse immediately. If the student is dehydrated, the causes could be vomiting, diarrhea, fever, or excessive sweating. Contact the school nurse and or parent, and a healthcare provider should be notified. In summary, we hope that you have gained the knowledge necessary to confidently and correctly administer gastrostomy feeding to our students. Please contact your campus nurse if you have a situation where you are unsure or not confident in your ability to administer the feeding to the student. Incorrectly administering a feeding can lead to harm and be potentially life-threatening. It is important to follow these steps. More one-to-one training can be done to increase competency and comfortability. Thank you.